my name is Evelyn Bunce. I'm a nurse practitioner student, and I'm performing a head-to-toe assessment on our patient Lizzie here. And we've done a thorough health history, and we've also had her put on a gown, empty her bladder, and I've noticed that she's pleasant, cooperative, and ANO ×4 throughout this assessment. We also assessed her vision and found she had 20/20 vision using the Rosenbaum and Snelling chart. So overall general inspection, starting with the head, I'm noticing she's normal. It's normal cephalic shape. The facial features are symmetrical, and I don't see any obvious abnormalities in the head area. So I'm going to ask you to make some facial expressions for me. So if you could do a big smile and then grit your teeth. Okay, good. And then if you could puff your cheeks out. Good. And then if you could stick your tongue way out. Good. And then can you move your tongue back and forth? Okay, good. And then if you could lift your eyebrows up to wrinkle your forehead. Very good. Okay, so I'm just testing the facial nerve with that. I'm also going to test facial sensation. I've got a cotton ball here. This is my cotton ball. Okay, if you could close your eyes and tell me where I'm touching you.
My forehead.
Okay, good.
Cheek.
Very good.
And chin.
Okay, very good. And so now I'm gonna, so the facial nerve, or the trigeminal nerve is intact. Facial sensation is good. So I'm gonna palpate her scalp carefully, noticing any bumps, cysts, lesions. I'm looking for symmetry. Isn't there any pain,
No.
tenderness? Okay, good. And I'm also noticing her hair, no split ends, and the hair is distributed evenly across the scalp. Okay. And then I'm moving to facial features. I'm going to palpate the facial bones, these frontal sinuses, any pain or tenderness?
No.
Okay. And then again, facial bones are symmetrical. Any pain or tenderness here?
No.
Okay. So the maxillary sinuses are not tender. The mandible is symmetrical. And then on the TMJ joint, or the temporomandibular joint, if you could open your mouth up and down. Good. And I don't feel any clicking or popping. Does that cause you any pain?
No.
Good. And I feel a good tone of the masseter muscle here. And then I'm moving on to your vision. So like I said, we have 20/20 vision. And I'm noticing the placement of the eyes. They're symmetrical. I don't notice any drainage or swelling. I'm noticing the scleras are white. I'm going to have you look up. So the conjunctiva is pink and moist. Very good. And then if you could close your eyes, I'm going to palpate the lacrimal apparatus, and it's, is it tender?
No.
And there's no heat or other swelling or signs of inflammation. So I'm also going to check for the red light reflex. And you can just stare straight ahead. Okay, you don't need to look at the light. And good. And continue straight ahead. And good. Red reflex is present. The lens is clear. And I'm going to do the 6 cardinal fields of gaze to check the oculomotor nerve. So if you can just follow this 10. Very good. Good. And there's no nystagmus. Ocular movements are very smooth. Very good. And then I'm also going to check the light reflex. So you can just kind of stare straight ahead. I'm looking for pupillary constriction in the directly, and then also consensually in the other eye. And directly and consensually, pupillary reaction is very good. Okay, so moving on to the ears. I'm noticing their placement, their symmetry, and I'm palpating the auricles, and they're smooth, firm, and there's no nodules or anything. So to test hearing, we're going to start with the Weber test. Actually, I'm going to do the whisper test first. So you repeat after me. I'm going to say a number.
7.
Very good.
5.
Very good. Okay, and then you tell me if you hear this equally in both ears.
Yeah, both ears.
Okay, great. And so now, that was the Weber test. So now for the Rin test, you tell me when you can't hear it any longer.
Okay, now.
Okay, so for bone conduction, that was 15 seconds. Tell me when you can't hear it.
Okay, now.
Okay, that was 30 seconds. Tell me when you can't hear it.
Now.
Okay.
Now.
Okay, good. 30 seconds. So there are no positive findings there. So now moving on to the inner part of the ear. First noticing the outer inner part of the ear. There's no redness, swelling, or visible discharge. So I'm pulling the pinna up and back. I'm bracing with my hand. I'm looking in the inner part of the inner ear to visualize the tympanic membrane. It's pearly gray with a good cone of light. And there's minimal cerumen in the left ear. And then same thing, pinna up and back. And the tympanic membrane is pearly gray with a good cone of light. Mineral cerumen in that ear as well. No redness, swelling, drainage, no bulging of the tympanic membrane. So now moving on to your nose. If you could occlude one nostril with your finger and breathe in. Any difficulty breathing? No. If you could occlude the other one. Any difficulty?
No.
Okay, good. So both nares appear patent. So I'm just noticing, again, symmetry. And I'm going to look interiorly. And they are, there's no visible turbinates. The nasal mucosa is, it's dark pink and glistening. There's no edema, and again, the nares are patent. So that's good. And then at this point, we could also test smell to make sure the olfactory cranial nerve is intact, which we did, and your cranial nerve, number 1, is intact. So then moving on to your mouth, I'm looking at the lips. I'm again checking for symmetry. I'm noticing any cracking, blistering, lesions, or asymmetry. And then if you can open your mouth and say, ah.
Ah.
Good. I'm looking at the tongue. If you can move your tongue back and forth. Okay, good. So tongue movements are smooth and coordinated. The teeth are clean, white, symmetrical. There's no missing teeth. And then if you could also... good. And the hard and soft palate are all pink and moist. If you could lift your tongue up. Good. The bottom of the mouth. No lesions. And I'm also going to look at the back of your mouth. So say, ah, the uvula is midline.
Ah.
The tonsils are 2+. And again, no edema, swelling, lesions, and patients denied throat pain. Finally, I'm going to test the gag reflex. If you could open your mouth. Say, ah.
Ah.
And gag reflex is intact. Okay, so moving on to your neck, I'm again noticing for symmetry. I'm noticing if there's any visible goiter, if I can visualize around the thyroid to see if it's visible. I'm going to have you lay at like a 45-degree angle. I'm going to sit here for a moment. If you could turn your... Good. And here I'm just checking for any jugular vein distinction, which I do not see. Okay. And if you can sit up. Okay. And if you can shrug your shoulders against my resistance, very good. And then turn your head against my resistance, very good. Excellent. Okay. And then I'm going to palpate the carotids one at a time. Good, it's a 2+ pulse. And, the rhythm is regular, steady. I'm looking at the position of the trachea, palpating the position of the trachea. It's slightly flexible, it's midline. And if you could swallow, helps me identify the thyroid, which is smooth. I don't feel any nodules, and it does not feel enlarged. So next for the lymph nodes, I'm going to start with your occipital. I do not feel any. And then the posterior auricular, and then the preauricular, and then moving down to the submandibular, the submental, the tonsillar. Very good. And then the posterior cervical, superficial and deep, and then anteriorly superficial cervical nodes along that chain, and then deeper. Okay, and then the infraclavicular and supraclavicular. So again, and I'm not finding any palpable nodes here, which is a normal finding. Okay, so I'm gonna get my stethoscope here, and I'm just gonna listen. Even though the thyroid was not enlarged, we're just gonna listen over it and listen to your carotids for any bruit. The thyroid, and then over the carotids, and no bruit is heard. Okay. Okay, so that concludes the neck part. So then moving down, I'm visualizing the skin. I'm noticing that it's even. There's a sparse hair distribution on the arms. I don't see any lesions, wounds, scars that could indicate the history of surgeries. Moving down to the hands, I'm noting the temperature. They're warm. The skin is soft and supple. Good cap refill, less than 3 seconds in all the fingers. Very good. Okay, so that is the upper extremities. So now moving on to the chest. Again, throughout this assessment, I'm noticing the work of breathing. Her respirations are even, they're unlabored, respiratory rates normal within 12 to 20. We can palpate the chest wall, any pain or tenderness, no crepitus. Very good. Okay, and so now if you could say 99.
99.
Very good. So I'm noticing the vibrations are symmetrical in both. So we're going to start with posterior. So if you could just turn. Okay. And first I'm going to palpate and percuss for the costovertebral angle, so I can kind of feel where the bottoms of the ribs are. You can also percuss from dullness to resonance, so you can know where the lungs begin. And then once you've got your costovertebral angle, if you could take a big deep breath in. Good, and I'm looking for even expansion. My thumbs are moving away from each other and then towards one another on expansion. Okay, and I'm going to do tactile fremitus again in the back. So say 99.
99.
Say 99 again.
99.
Very good. So again, the vibrations are even in both sides, which is what we're looking for. Okay, so then we're going to auscultate after we percuss. So again, we percuss down at the bottom to get the resonance, so now we're going to do the same thing starting at the top. So I'm comparing one side to the other. And what I'm hearing is resonance, which is a normal finding. If there were any areas of dullness, we would investigate those more thoroughly. But again, resonant throughout. So I'm going to auscultate. If you could inhale. 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 Exhale. Good. And the bottoms of the lungs, throughout the lung field, vesicular sounds, no adventitious breath sounds, no wheezing, no rales, no bronchi. And I'm also going to listen, I'm going to percuss and listen on the lateral aspects as well. Good. So resonance is heard. And also auscultate. It's important to do on the skin. Deep breath in. Very good. Deep breath in. Very good. Deep breath in. Good. And one more. Good. So again, no adventitious breath sounds on the rest. So now we need to just percuss a little and listen in the front. So if you could, actually, you know what? While you're, we're gonna mark. We're gonna do diaphragmatic excursion. Okay. So when you take a deep breath in and hold it. Very good. And so I'm gonna percuss down till dullness. All right. And then I'm gonna mark that. You can exhale. Breathe normally. And now take a deep breath in and exhale all the way. And now I'm going to percuss up from dullness to resonance. Very good. So I'm going to mark that. And then we would do the same thing on the other side. And we're noting it's a 3 to 5 centimeter difference. And then on this side, if you could take a deep breath in. Okay, and exhale. Good. And then when you're ready, deep breath in, and then exhale all the way. Good, and mark that. And so we notice that the left side is slightly higher than the right, and which is a normal finding because of the placement of the liver. Okay, so then, again, if we found any abnormal findings, any areas of dullness where we percuss or any crackles or anything like that, we would maybe do like whispered pectoriloquy or bronchophony, but it's not necessary. So I'm going to listen in the front. Usually we'll percuss first. Good. Resonance is heard. Very good. And then we'll listen. Okay. So if you could take a deep breath. Deep breath. And towards the sternum, take a deep. I can hear more bronchovesicular sounds. Bronchial sounds over the trachea. Good. And vesicular sounds throughout. Very good. Okay, so moving on to the precordium and your heart assessment. First, I'm just noticing if I see any heaves, lifts, thrills, any visible pulsations. So to kind of estimate the heart size, we're going to percuss where we hear that resonance down to where we hear dullness. And we're marking. And this is where we're looking for cardiomegaly, but ultimately a chest x-ray is the best determiner of heart size. So, and she did have that, and she does not have cardiomegaly. But again, we would percuss up from the bottom to get those general margins of the heart size. So we want to visualize the apical point. So we're looking at the 5th intercostal space at the midclavicular line, and we're looking for any pulsations. And if we can't see, we can also we can palpate for it. And I do feel it, and it's not bounding, or there's no rubs or heaves or lifts or anything. So that is a normal finding. So then we're going to auscultate your heart. So we're beginning at the aortic area on the right side, and then the pulmonic area, 2nd intercostal space on the left side, Erb's point, 3rd intercostal space, and then between the next intercostal space down, the tricuspid point, and then the mitral, or again the apex, and we're going to listen underneath her shirt. And that's where we hear the apex of the heart beating. Okay, so now we're going to proceed with your abdomen assessment, so if you can lay down. Okay, so again, starting with a general inspection, I'm looking for any scars, I'm looking for any, the general shape of her abdomen, the skin color. I don't see any jaundice, that would indicate like a liver dysfunction. So the general inspection, and we can also note symmetry and any pulsations, any visible visible movement in the stomach. And so we're going to begin with auscultation. And I'm going to listen for a full minute in each quadrant. I'm listening for clicks and murmurs, about 5 to 15 per minute in each of the 4 quadrants. And finishing with the lower left quadrant. And her bowel sounds are normal active, which is a normal finding. So now we're going to start to determine the liver size. We're going to percuss, and we should hear tympany to dullness. And when we hear dullness, we'll mark it, and then dullness again. And at the line of the umbilicus, we'll stop. And so we'll mark that line. And then starting at the chest wall, we'll percuss down from resonance to tympany. Resonance to dullness, rather. Good. And so that gives us an idea of the liver size, and her liver spans about 9 centimeters, which is a normal finding. So same thing, we're going to percuss for the spleen, starting past the costal margin, which tympany, it's a good sign. So the spleen does not seem to be enlarged. So between the 9th and 10th intercostal space, I feel some dullness. It's a small area, which indicates the spleen, so it is not enlarged. So that is a normal finding. We're also we can percuss in each quadrant as well, and we're looking for tympany. Okay, so then beginning with light palpation, we're feeling for any masses, any lumps, nodules, areas of tenderness, you let me know. Okay, very good. And then moving into deep palpation, we'll start at this costal angle and feeling for the border of the liver, which is just barely palpable underneath that costal angle. And it's firm and a well delineated margin. And again, palpating over on this costal margin, don't feel the spleen, which is a good finding. Okay, and so moving into deeper palpation, sometimes stool can be felt in the lower left quadrant. It's not, no masses. Moving midline, slightly left to the midline, feeling for the aorta. And no pulsations felt, and it's not more than a centimeter. in width. Okay, and again, the deep palpation, we're just feeling for any masses or no eliciting any tenderness, which we have not. So finally, we're gonna palpate for your kidneys. So if you could sit up. Okay. Oops. And I noted while you were sitting up your abdominal muscles.
Mm-hmm.
So so that is you have good abdominal strength. Okay. So I'm gonna deeply palpate for your kidneys, which they're not palpable, which can be a normal finding. Okay. And then, and one more thing I'm going to auscultate, if you could just lift your shirt up again. And lean back. Okay. Also, even though the aorta, there was no pulsations, we'll still listen to hear if we see hear a bruit, which we do not. And then the renal arteries. Again, no bruit. And then the iliac arteries. Okay, and then the femoral. And again, no bruits heard. Okay, and then, so moving on to the lower extremities. Again, I'm noticing symmetry. I'm palpating for any edema. Noticing any skin changes or issues. Coming down to the feet, I'm noticing the temperature, which they are slightly cooler than the body. And I'm feeling for the dorsalis pedis pulses, and they're 2+. And then the posterior tibial pulses, those are also 2+. And then the popliteal pulses, those are also 2+. So again, no scars, no wounds, no issues. I'd also look at the bottoms of the feet, and check capri fill in the toes. Okay, and so now moving on, we're going to check your reflexes. So your brachial reflex. Good. And just relax your arm. Good. And then your knees, if you could just. Good. And then your Achilles. And then just to note overall muscle tone, she exercises regularly, has good muscle tone. Can you squeeze my fingers? Good. And can you push against me? Very good. So has good muscle tone. So now we're just going to check cervical movement and strength. Again, I'm noticing the trapezius muscles are symmetrical. We're going to do those same movements again. So if you could flex your neck down, I'm looking for a 45-degree angle, which you have. If you could extend your neck up. Good, about 55 degrees. And then if you can do some lateral bends. Okay, those are about 40 degrees. And then rotation. Good, and I'm looking for a 70-degree rotation. Any of that cause you pain?
No.
Okay, very good. And then if you could stand up, we're gonna check your lumbar spine. Again, we're just noticing the spinous processes of the spinal column. And then does this elicit any tenderness?
No.
Okay, very good. And then if you could bend forward, I'm looking for a forward flexion of about 75 degrees, which is very good. And then I can support you, lean back. Good, about 25 degrees, about 30 degrees, that's a normal finding. And then laterally bend. Good, those are about 30, 35 degrees. And then if you could just rotate, we want to see good rotation. Does that cause you any pain?
No.
No, and she has smooth, easy, good rotation. So, and you can have a seat.
Okay.
Okay. So that concludes our head to toe assessment. Thank you very much.
Thank you.